Yeah, Jen from Raleigh. She's interested in trying some CBD and was wondering which variety you recommend and your best seller. Well, I do like CBD. CBD is a family of compounds, oils found in a hemp plant. Okay, it does not include, in this case, THC. THC is the component in marijuana that makes you, it's psychoactive and makes you high. So it does not include that. It's the other oils in the hemp plant that I'm talking about. And there's multiple oils. And we carry a brand here that we think is the best. It's called Naternal. And I've got some available when I saw this question. So the Naternal comes in several varieties of oils, and we also have it compounded or up into some, it's not really compounded, it's available as a muscle cream also. But the bottom line is the oils have medicinal properties, and Naternal is, in my opinion, the market leader in terms of the quality of the stuff. So I've seen their operation firsthand. They're out here in the Research Triangle Park. The products are grown right here in North Carolina. They're processed in the Research Triangle Park. I've seen every step of the process, and the quality control and the testing is excellent. It is superior to anything that I ever thought I would see, and they're doing it right. So when you get their products, they're going to be the best products. They're going to be in compliance with all federal and state laws, and they're going to be exactly what they're advertised to be. Now, there's another question that we got about this, and this is kind of a good time to talk about it. I've been looking for the opportunity to do so. Your body has an endocannabinoid system. So you make compounds in your body that act like these compounds and mimic these compounds that are found in the hemp plant or cannabis, okay? And you have receptor types, and these things are involved in your hunger, amongst many other things. This is kind of an important system in your body. And so there is a receptor type in that endocannabinoid system that when the compounds bind it, when certain compounds bind it, it makes you hungry. Okay, and so there was a diet drug in 2006 that came onto the market in Europe that was wildly popular, and subsequently was taken off the market. But the action of the drug was to block that receptor. Okay, and the problem is that people became a small percentage of people became really depressed with that. Okay, because the same kind of receptor, I guess, can make you feel happy. Think people smoking weed, feeling all happy, laughing, all that sort of thing. Well, if you block the ability for that to happen, so a certain number of people are going to get depressed. But this thing is important in terms of hunger and craving. So what I like about these oils is these oils act as partial blockers of that receptor, but not so much that you get depressed. In fact, most of my patients will feel like that they actually have improved mood.
Yes.
And so you can select out certain oils in this family that have a potent anti-inflammatory effects, for example. So one of those I have here called, they call it Move. Naternal calls it Move because it is a potent anti-inflammatory. They take the full spectrum CBD oil and add some extra CBG, which is one of the oils in that family. So you get a higher concentration of the CBG. Now the CBG is the most potent of the anti-inflammatory oils in that family. And so this is an example of how you can really create a supplement that has medicinal properties to it that are really potent. And I use this myself because I don't like taking them. If I take, for example, these over-the-counter pain relievers, they do things like give me heartburn, and I don't like it. And I don't have to worry about it with this, right? And so if I have muscle soreness or whatever from working out, this has been a great product that I really like. Now, one of the other questions we're going to answer here toward the end is about a study that was recently done at Oregon State University. I think Richard Van Bremen is the guy who conducted the study, but they studied these. It was written up in Forbes. So look, I'm just telling you what was in the Forbes article and what was in the study. So don't get mad at me and talk bad about me if I say something here that runs contrary to what you believe ought to be out there on the internet. If you censor me, you're just censoring the Forbes article or what they got published, okay? But the bottom line is that CBG was one of a couple of oils that they tested on the COVID-19 virus, okay? They started with the theory that some of these oils actually prevent the binding of COVID-19 spike protein to the ACE2 receptor on your cells. That's how it gets inside there. Okay, so a lot of you have heard of that spike protein. The spike protein binds to what's called the ACE2 receptor on your cell membranes, and that's how it's able to enter. And these oils in their study, particularly this CBG, binds to the spike protein, okay? Prevents the spike protein from binding then the receptor site on the cell. This was their finding, and it was written up in Forbes magazine. I'm just telling you what I read. I'm not going to say anything about it really other than that, just so that you know this is kind of, this is kind of cool stuff in my opinion. It's kind of cool stuff to know when we got all these, we're thinking of all these weapons to try to stop the transmission of this virus, stop you from getting it, this sort of thing. If a supplement helps, I'm all for it. I got nothing against that. And I'm all for vaccines. I'm all for every other measure that's out there. And I'm also for that. So,
thank you, Karen. Yeah. You're the one that asked about that study in Forbes. You asked us to share our thoughts on the study in which cannabis compounds may prevent infection of COVID-19, referring to that Forbes. So
that's right. I'll come back and touch on it just a little bit. But the other thing that when I was reading the article, I came across another piece of information. Forbes is a financial magazine, okay? And along that same line, you can see there is a title there that says Pfizer is making a big buy into medical cannabis with a $6.7 billion with a B acquisition of a cannabis compound company. Okay, so they get this. Pfizer, the same one that made the vaccine that most of you got. Okay, that most of us got, should I say? Okay, Pfizer, a huge pharmaceutical company, just dropped $6.7 billion into this arena because they recognize the medicinal properties here. So this stuff's not just, some naturalist down on the corner with this little store whipping up some stuff. This is big money companies, right? They're like, whoa, hey, this has real potential. So keep watching this stuff. I think I think there's an exciting future ahead in this area. So if you're interested in CBD, we've got deals. Check out our email. We've got good prices on that internal stuff, better than you're going to find anywhere else. And we do sell a lot of it. And I don't do a lot of arm twisting about it or anything. I think most of my patients probably have read about it, thought about it, and then they tried it. And many of them come back with pretty fantastic stories about how well it works for various things, right? Yeah. So welcome again.
Yeah, welcome again. We're here.
Metabolics and Weight Loss. Ask me anything. Live Facebook
Looks
event.
Like Nicole and Letitia have entered. Thank you so much. And what they're entering is for a $25 Target gift card. All you got to do is like this video and write hashtag Simonds AMA, just as they did in the comment section. So if you'd like to enter at the end of this show, we're going to pull a winner and then get you that gift card. And then we're going to do this again in 2 weeks. So make sure to tune in if you are watching this recorded.